Hey, good afternoon, everyone that has joined us so far. I can see we have a number of participants still coming in. And so while we provide a little bit of time to let people come in, I'll start off with a little bit of housekeeping for you all. So welcome today. We're really pleased to have everybody join us. We've got some really excellent panelists and speakers for you today. To begin with, there'll be some presentations for you, but there's also going to be the opportunity to use the Q&A function if you have any questions. And our presentations will have about a 10-minute session towards the end, and they'll take as many of the questions as possible. So my name's Lee Clark, and I'm the CEO of the VHA. And to first begin, I'd like to acknowledge the traditional custodians of the unceded lands from which we are all coming today. So for myself, that is the Wurundjeri Woiwurrung people of the Kulin Nation, and I believe also for yourself as well, Helen. I recognise continuing connection to land, waters and culture, and pay my respects to elders past and present, including people extend this to also people Aboriginal Torres Strait Islanders that are joining us today. I'd also encourage people to pop in the name of the traditional custodians of the lands in which you're joining us from, which I know that many will be from across varying regions of Victoria and further afar. So this webinar today is brought to you by TriPeaks. TriPeaks is a collaborative initiative across 3 organisations: the Centre of Excellence for Child and Family Welfare, which we affectionately just call the Centre to make it a bit easier, the Victorian Alcohol and Drug Association, VAADA, as well as the Victorian Healthcare Association, which known as VHA. The project has a couple of key aims, and we work in a number of areas, but really, the overarching aim is to expand cross-sector collaboration, promote good governance and integrate practices across child and family services, alcohol and other drug and community health sectors as well. So today we're really delighted to be joined by speakers from Human Ability and also our own Helen from VHA. And we have a thought-provoking discussion on the ways to mitigate some of the national workforce shortages across both across healthcare and the social services sector. By way of sort of an introduction to the organisation, and I'm sure Emma will cover off this as well, but Human Ability is a not-for-profit industry-led organisation. It's founded recently to drive the advancement of education and workforce development, particularly in age, disability services, children's education and care, health and human services, and sport and recreation industry. So just a really little remit. They are committed to engaging with industry leaders to identify skills and workforce needs, map the career pathways for the sector, and develop tailored training solutions. So I'm really pleased today to have 2 team members from Human Ability here. We have Emma King, who is the inaugural CEO, and Jenny Courtney, who's the Executive Director of Stakeholder Engagement. And they're going to share some of their learnings from their ongoing stakeholder consultations and identify some of the top-level strategies. And I know they've been traipsing their way around the countryside, having some of these conversations recently. So I'm going to introduce our 3 speakers to you. They've got some extensive bios. So first of all, for Emma, Emma was appointed as Human Ability's inaugural CEO in September 2023, so just recently, and she's bringing to the role extensive executive experience, particularly in workforce and education. And prior to this, she served as the CEO of VCOS, the Victorian Council of Social Services, for a 10-year period, where she played a really instrumental role in advocating for social justice and equality. She's also previously been the CEO of Early Learning Association Australia, working in the childhood education and care provider sector and engaging with government and stakeholders to advocate for high quality, affordable and accessible childcare education. Has a background as a teacher and as a senior education advisor to the Victorian State Government, as well as numerous board roles. In 2023, we were all very excited to see Emma awarded a Medal of the Order of Australia in recognition for her service to community, which was wonderful. I'd also like to introduce Jenny to you, who has over 15 years experience in communications, engagement and change management. And she loves to bring people together to work collectively on big issues and make a positive impact. So it sounds like she's well in the right place at Human Ability. Having most recently navigated the complexities of hospital, community, aged care and disability care in regional Victoria amidst the challenges posed by the pandemic, she is acutely aware of the challenges that's faced in the care and support industries, both now but also those coming into the future. She also brings a wealth of knowledge in education and skills landscape and has previously worked in university, careers, education and development, and looks forward to working across the nation to gather everybody's sector insights and industry experiences. And finally, the VHA's Helen Rizzoli. Helen is the General Manager for Sector Capability, and she's going to join you today to outline the VHA's planned strategic approach to build sector capability, including the development of a leadership capability framework. As the General Manager of Sector Capability, she brings strong leadership system design skills, facilitation and coaching to identify the most urgent professional development needs for our sector and to connect individuals to the opportunities that will assist them to grow their understanding and their knowledge and to create safe spaces where these skills can be practiced as well. She has worked in the health sector across Australia and in the Middle East for over 30 years in roles spanning areas such as leadership, strategy, performance optimisation for both service providers, but also for government departments. So thank you everybody for joining us today. You have a wonderful array of panellists and speakers for you. And I'm now going to hand over to Emma, and I think we're going to be bringing up your slide deck, Emma. So welcome. Thank you for joining us.
Thank you so much, Lee. It is fantastic to be here and amongst friends, old friends, am I allowed to say in the nicest way? It's kind of feels nice to be coming home in a way. If I can begin by also acknowledging the traditional owners of the land that we all meet on today, and any Aboriginal and Torres Strait Islander people who are with us. I'm on the lands of the Wurundjeri people of the Kulin Nation, so I'd like to pay my respects to elders past, present, to emerging leaders, and acknowledge that it always was and always will be Aboriginal land. I have the pleasure of being here with my colleague Jenny, as Lee just introduced, to work through, just to take you through a bit about human ability. And we thought it would be really good to start with an overview in terms of who we are and what we do. So Jen's doing the slide deck for me, because anyone who knows me will know that this is not my forte. So there's a very quick overview here on the screen in terms of what we're responsible for, and Lee touched on that as well. So in terms of looking at workforce planning, and also vet qualifications across, when we say care, support and recreation industries. I want to name up front that I suspect the notion of care and support is not loved by anyone on this webinar, in that they're not the terms that we choose, but they're terms that government regularly uses so that they're well understood. We're obviously working alongside around how we develop strategies to equip workers with the training and skills they need for today and for the future, but really working with employers and with unions and with government as well, to hear how that kind of resonates from everyone's perspectives as well, to make sure that what we're doing is contemporary and up to date. Jen, I might get you to jump to the next slide if it's okay. Now, this slide gives you at a glance a very quick overview of what our remit is at Human Ability. So looking overall, you'll see sort of human ability, the sectors that we cover, and then our remit within those sectors. By way of background, because you'll look at aged care and disability and say, well, that is part of human and community services, which is absolutely right. But one of the things that we became aware of when in the very early days of Human Ability in September was to say, well, because of the Royal Commissions that have taken place in disability and aged care, we separated that out from the remainder of the structure so that we kind of focused on that. For us as well within, and I'll talk about this a little bit further, what we have is industry advisory committees that sit within each of these areas that help guide our work in that space as well. So we're very keen to make sure that we'd separated out disability and aged care from health and broader community services as well, just to give each of those areas a sort of the space they need and deserve. But it gives you a sense of our very broad remit for which we are. I think it's fair to say the Jobs and Skills Council, which actually I should go back and touch on a bit as well. In terms of our Jobs and Skills Council, we are one of 10 Jobs and Skills Councils that have been established by the federal government. This is obviously our remit. There's a range of other Jobs and Skills Councils that, for example, work with mining and automotive, or with building, for example. So where the Jobs and Skills Council, we say that works with people fundamentally, and you can see the areas that we cut across there. So all of the Jobs and Skills Councils are new, came into operation on the 1st of July last year, but varying degrees of age and stage. So some had existed as previous organisations, and really it was a combination of work that the federal government had led that took 67 plus organisations and then work them through to become about sort of 10 with a broader remit, which if we jump to the next slide, I can talk a little bit more about our role. So in terms of the Jobs and Skills Councils overall, including human ability, there's a very strong role that we have to play in terms of looking at industry stewardship, and that comes to all of the sectors that we work with. To when we say implementation, promotion and monitoring, that comes across all of the areas that we're working with, and training, product development, and really the workforce planning role that we have, if you like, there's sort of this overarching umbrella piece to everything else that we do. So we're currently working with Impact Economics to develop our next workforce plan. The very first one that we did was a desktop review by virtue of the fact that we had a skeleton staff on board, and we hadn't had the opportunity at the time to go out and to consult broadly with industry. And when I say industry, I mean that in the broader sense, in terms of employers, employees, unions, etc., and government. So it was a desktop analysis. And with this workforce plan, which is due in on the 30th of May, we're really working to consolidate that in terms of giving an overview of the contemporary state of play, also looking at some economic modelling, or undertaking some economic modelling in terms of what's the current state of play, what's the desired state, in terms of looking at what we need in terms of workforce, and then also really looking to amplify industry voice in alongside that as well. So it's that combination of quantitative and qualitative analysis, and that for us will create much of our work plan over the year coming ahead. But what we're hoping for as well is a really strong flagship document that everyone on this call and beyond will be able to really call on and reference as a very contemporary analysis of this is the state of workforce now, this is where we want to get to, and some real insights from industry in terms of cutting across metro, regional, rural, lived experience, and many of the cross sections of our sector, and we'll continue to build on that each year. So it's an annual deliverable for us, and one that we'll continue to build on as well. So there's lots of industry engagement to happen with that. Jed, if I can get you to jump to the next slide as well. So this just gives you a little bit of an overview in terms of the way we work. Obviously, we've got a board, which is tripartite, which reflects the way that we work. There's lots of stakeholder engagement meetings that we hold. We have forums, including one in Melbourne next week. So, and I'll go to that further at the end. If you haven't had a chance to register for that yet, I'd really encourage you to do so, because it's such a great way for us to be able to hear from you in terms of to have your voice heard, and looking at what you see as key opportunities, key challenges, and also really where there are really great examples of where there are things underway. It's a great way for us to be able to capture that as well. And for you, if you can inform our work is a key piece that the federal government is going to draw on as well. So it's a really fantastic way to have your voice heard. And within our governance structure, as well, as I mentioned earlier, we have the industry advisory committees, one for each of the sort of the subsectors that we represent, and they assist us in looking at where there are particular opportunities and priorities as well across our broader remit. So in terms of the journey so far, I won't read all of this out, given that you can have a quick look on the screen, but you can see in terms of we were launched in July, we hit really quickly in terms of moving to establishing our industry advisory councils. I do want to call out that we intentionally held our first forum in Alice Springs. We're very conscious to make sure that we were going to, the middle of Australia, and very intentionally to, a community that is very strongly and proudly a First Nation community, and we wanted to hear from people about what the particular opportunities and challenges they're facing on a workforce front. And I guess we started as we meant to continue there as well. We then followed up with a forum in Canberra, which Lee from VHA was fantastic to attend, I should say, but Helen attended our forum in Alice Springs, which was a national forum, which was emceed by Annabelle Crabb, had a range of speakers from across the industries that we have, including, in addition to that, having Angela Jackson from Impact Economics to do that scene setting piece as well, and having Stan Grant speak. And we're also working very closely with Jobs and Skills Australia on their early childhood education and care workforce strategy as well, because it falls within our remit, and we're conscious of making sure that we're not falling over each other in our work. So we co-chair the steering group on that front, and also we're very mindful about what we're asking for people in that early childhood space, that we're not kind of double consulting and consulting once and then using often. You can then see, in terms of looking at the other work that we've been undertaking across the states, and I think the next slide will step into that a bit further in terms of what's coming. But one of the things we're mindful of in every state and territory that we're visiting, and we will visit everywhere across Australia this year, is we're not just visiting the capital city, we're also making sure we visit at least one regional or remote community as well. So in terms of our challenge ahead, one that's probably well known to many of you, if you look simply at the health workers that we need alone, the issue that we have in Australia isn't an Australia only issue. It's much broader than that in terms of looking at World Health Organization, and falling short by 10 million health workers by 2030 is pretty alarming in terms of thinking of the challenge that we have ahead of us. And it's certainly something that I think is top of mind for our governments. And then when you factor that out more broadly to think about what does that mean for Australia, and looking at healthcare and social assistance workforce, you can see there's exponential growth taking place, or that's required. And there's a raft of issues that we're in the process of identifying, and I would describe as opportunities in terms of how do we actually meet that growth going forward. We've had a number of different reports come out that really articulate both the challenges and opportunities. An example of that is Jobs and Skills Australia released a white paper that included their projections around the care and support economy, and that it will grow by 22% by 2033. So lots of data there to show where the need is. And I suspect everyone on this call will be feeling this pretty intensely, because we know that it has so many different ramifications across every workforce, and also for the recipients of services as well. In terms of what we've heard, we'll jump to the next slide. So as I mentioned, we've been going around the country, and this is an overview in terms of what we've heard from people directly so far. So we know that our workforces, by and large, are heavily gendered. They're very feminised, with the one exception being that in sport and rec it's slightly the other way. But again, as you'd expect, if you do a sort of cut across each subsector, they all play out in a slightly different way. So some elements of that workforce would be more gendered than others, but overarching in terms of the workforce that fall under our remit, they're heavily gendered. I suspect nothing on here would be a surprise to anyone who's on the call in terms of looking at things like low wages. And when we look at issues such as placements, which we have heard everywhere that we've gone, placement poverty is real. And there was fantastic, sounds like a terrible way to describe it. There was a really great op-ed actually in The Age today for someone writing about their flatmate and them experiencing placement poverty and what they're expected to do. Well, in effect, in their case, they were describing it as, you know, they're paying for the privilege because they're paying through HECS fees to undertake all of this extraordinary work that they can't work at the same time. So lack of data overall, data collection, some of the work that we're hoping that we can address, and significant issues as well around job perceptions and really limited professional development. And I think broader perception, not only just lack of skills recognition, but it goes to that perception across society overall about the worth of the work that's undertaken in the sectors that we work in. And it's something that we're very passionate about and hoping to work with all of you to change. So then looking at, I think our next slide jumps to the bit of the what's next. This slide just gives you an overview of some of the work that's coming up for us over the next 6 months. And you can see where we're heading in terms of across the country. We're looking forward to our national forum as well in August, which will be opened by Minister O'Connor. And really, I do want to pay credit to the Minister and the federal government in terms of having, I think, the ambition to set up the Jobs and Skills Councils, knowing that we have significant challenges, as I've mentioned, and really being happy to unearth those and to think about what's coming. So we know, for example, that the Prime Minister and Cabinet is leading a national care and support economy strategy, and they're highly attuned to the needs of all of the organisations that are represented on this call and across Australia as well. So we have a particular opportunity for those of us who've been in this sector for a long time. I think when we see different workforces that have been elevated for attention, we've really called to say, well, actually, where are our sectors in that? And now we can see actually there's an extraordinary amount of work being undertaken, both across within the approach being taken within Prime Minister and Cabinet, which is really setting the scene, but within the Royal Commissions and the White Paper and other key reports that have been released, we're really seeing our sectors being elevated really for the first time in this way, in a federal way. So it is a really exciting moment in time as well. In terms of our focus on 2024, and I'm keen to not talk for too long, so we've got time for questions as well. You'll see in terms of looking at our focus over this year, also, we do, if you're happy to jump to the next slide, Jen, we do have a focus on looking at what can we do around the supply side of the labour market. And we know that some of the aspects of that fit within our remit and some fit within others. So we're conscious of the broader ecosystem, what our role is within that ecosystem and what we can drive, but how we work with others who've got that opportunity to influence other change, and how we have the best collective impact and influence by working together. So for example, if you think about the recent aged care decision, which was led by the unions and some employers around looking at driving up wages in that sector so that there's a bigger incentive for people to work there. We're watching some of the same work take place within the early childhood sector at the moment as well, and to think about how that work impacts the work that human ability does, so that how we can kind of come together to have greatest impact and influence more broadly. So looking at what are some of the key drivers for the supply side of the market. One of those is also the delivery of and access to training, and we've heard that everywhere that we've gone. So we've got this fantastic opportunity, for example, in free TAFE, recognising that not all courses are offered in TAFE, and people will access them in other RTOs or in other areas. But we've really got to look at how do we make sure that we're creating the greatest opportunity for people to be able to access training, and really look at how we attract and retain both students and staff so that we can have the workforce that we need for the future. So that goes to supporting students on their way through, as well as into jobs as well. And we know that also one of the other key opportunities for us is the pathways between vet and higher education. So it depends on, for any individual, where they are. For some, they'll be starting in pre-accredited training and looking perhaps to move their way through to accredited training so that they can undertake work, because as we know, for more and more elements of the workforces that we've got, you require qualifications to be able to get a role in those jobs, albeit I acknowledge that some areas of that are contentious, particularly in the disability sector at the moment. But thinking about however it plays out, I've got to be really conscious as to my colleagues at Human Ability and our board about what does that mean for training packages, and how do we update them, and how we're responsive to the contemporary environment as well. And just looking as well for people who might start within vet and then think they'd like to move through to higher education, and providing those opportunities too. In terms of looking at the training packages, I suspect a few people will have deep interest in these. One of our roles, for those of you who've been involved with our sort of predecessor organisations, you may be aware that when it came to training packages, there were technical advisory groups set up as we will set up as well, but the consultation was primarily kept within those groups. That will not be the case for us. We will be out consulting far and wide when it comes to any review of training packages, to have feedback from people in terms of looking at what might be the things that actually need to be included there. We know that not everyone will be on a Unity ticket, and that is okay. The key thing is that we hear people's voices, and then we go through to make a recommendation to skills ministers in all of the states and territories as well for their consideration. So at the moment, we're really looking through our broad range of qualifications. We have over 100 quals that sit within our remit, and there's additional skill sets as well. And we really want to test as many of those as we can to check that they're meeting industry needs. And to be frank, we know that some are not. We're reviewing the currency of current packages at the moment. And then, because we can only look at so many packages at a time, and being pragmatic, really identifying which ones need to come up for review first. And an example of that is looking at the Certificate 3 in individual support and Certificate 4 in disability. They're absolutely up the top in terms of looking at the courses we're looking at. Others under active consideration are decoupling the Certificate 3 requirement to have a Certificate 3 in early childhood education to be able to undertake a diploma. And then I think probably not too far down the track, we'll be looking at qualifications for peer support in mental health, for example. So we're looking at also identifying the need for new training packages. And we know that when we look at the Royal Commission findings, they're going to impact reviews into different training packages as well. So that's work that's very much in progress. So that's pretty much a Cook's tour in terms of what we're covering overall. And then the very last slide I've got for you is just to flag our forum next week in Melbourne. We've got a link in here if you're keen in, Jenny, if you're happy to jump to that one. If you're interested in coming along, we're meeting at the RACV on Monday, 9:30 to 1. It's a great opportunity to be able to come along if you're, working in a specialist role or a manager, and we will be having a separate CEO roundtable as well. Minister Tierney is coming along to speak at the forum, which is fantastic. We'll also have Impact Economics speaking at the CEO forum as well in terms of the workforce report that's underway. But it's a really fantastic opportunity to come together, have your say and be heard in terms of specific, as we've mentioned earlier, specific workforce challenges and opportunities that you see, and have your voice heard in terms of the key recommendations that will find their way to federal government as well. So I might pause there, just quickly check with Jenny to see if I've missed anything, Jen, that you would like to add in, and then hand over to Helen. Jenny's shaking her head at me. So I will throw to Helen. Thank you very much, Helen, and then come back later for questions. So thank you.
Awesome. Thanks very much, Emma. And Emma, just before you jump off screen, can you give me a thumbs up if you can actually see my slide presentation? Awesome. Thank you. There you go. Multitasking. Hi, everyone. And for those of you who joined a few minutes late, I'll just go back to the start and say, my name's Helen Rizzoli, and I am the General Manager of Sector Capability for the Victorian Healthcare Association. We're so glad to have you with us today to talk about this important topic around workforce development. I commenced with the VHA 6 months ago, and really my role is a new one. It's about translating our VHA board strategic vision for the VHA's role in professional development in the healthcare sector, and taking that into a professional development reality. Now, Emma and Jenny were talking before with sectors or care sectors more broad than just healthcare. My particular presentation is going to be focused on the VHA scope. So I am going to use the word healthcare a lot, but I guess anything that we're saying in this particular presentation, think about it in terms of the skill sets that are required in people and organisational leaders anywhere. And so Human Ability have just been talking about the approaches to getting strong foundations around technical skill sets that are required in the care industry. Our focus is a little bit different because it's non-technical and it's non-clinical. It's really about people and organisational leadership roles and the capabilities that are required to become a good people leader or a good organisational leader. And what we often find is that we get some really well-trained clinicians, technicians, and they come in and they do their care task really well, but ultimately they will be promoted into some sort of management or leadership role. And there's a whole new swath of capabilities that come with that in order for them to survive and thrive and be the best version of themselves in those roles. And they're not always well set up for it. So the VHA in its sector capability vision is really about identifying where those gaps exist in the education system so that we can really backfill those gaps with professional development opportunities that our people from our member organisations can link into all the way along their career journey, from the first time for their first management role right up to we support new board directors and new board chairs, because the capabilities are the same, but what you find is the way that people have to deliver them and the maturity of their expertise changes depending on how far up the organisational chart they go. We do find in health, and I'm sure it's true in other care sectors as well, that each new health sector leader will come equipped with some previous leadership knowledge, skills, experience. They've seen somebody do it before and they've copied them and they do it well. But most will bring some sort of inherent leadership gaps in terms of capability, and they will require strategic development in order to hone these abilities. And it has a very large impact on the people and the organisations that they manage. So the more we can do to support those new and emerging leaders to be the best version of themselves, the stronger we build the capacity and the capability within the existing workforce to stop, hopefully, that drain of existing workforce. Because as Emma showed in one of her early slides, we don't need to lose any, we need to gather a lot of additional workforce over the next few years. So strap in, this will be a bit of a whirlwind tour, but I did want to take you through this opportunity to bring you up to speed on our development of a leadership capability framework, and perhaps more importantly, let you know how you can contribute your thoughts into it, because while the VHA is preparing it, it needs to be a leadership capability framework that reflects the needs of the sector, not what VHA think the needs of the sector are. And as I'm talking, I'll just encourage everybody to think about your questions and pop them in the Q&A function you should have on either the bottom or the top of your screen, because we will have 10 minutes for Q&A after I've finished speaking, and I'd love to be able to get to as many of your questions as possible during that time. All right, so to help explain this work in the context of how we support healthcare, the healthcare sector in Victoria at the VHA, I'll start with our strategic plan. So we all know that all Victorians want high quality and personalised healthcare delivered by a strong healthcare system that's committed to improving the health and the well-being of its communities. Notwithstanding the need for excellence in the provision of clinical care to achieve this goal, the provision of high quality and safe care is dependent on the effective management and leadership of our health service organisations and workforce. So that's why the VHA strategic plan for the period 2023 to 2026 has one of its 3 strategic pillars to build sector capability. And our vision in this space is to empower our members to build that capability and to develop skills that they can implement immediately in their roles. So given this brief, we took the decision to start with developing a leadership capability framework to allow us to see where the priority areas are, and that will inform the professional development offerings that we either design and deliver from within VHA, or we partner with other organisations to make it easy for our healthcare sector workforce to navigate to those skills uplift professional development opportunities that they need. Now, for those of you online who've done even minor amounts of thinking in this space, you might say, but Helen, there are actually a lot of well-respected leadership capability frameworks that already exist nationally and internationally for the health sector. And you'd be right. So why does the VHA feel the need to replicate the work that's already been done? And the answer is we really looked at that. We've done quite a bit of analysis of the existing frameworks. And looking at them in the context of the Victorian healthcare system, the structure of our system in comparison to other jurisdictions, but also the level of maturity in our system and the current needs and priorities of our system. And we felt there was a need to really identify priorities for our sector in this time, rather than leveraging what might be used elsewhere. But that doesn't mean we weren't happy to really mine all of that great work that's already been done and to use that as the foundation on which we'll be building our leadership capability framework for the VHA. So on the screen, you'll see a lot of the publicly available capability frameworks that we'll be leveraging off. And for those of you who are not so familiar with what these frameworks do, they're different in design and they're different in focus. As you go through them, you'll probably see, if you do the same analysis we did, that there's about 80% that's similar and about 20% that's unique to the jurisdiction or the agency that's created them. But essentially, they all do the same thing. They describe a set of attributes or categories that really support a person to survive and thrive in a people management or operational leadership role. So that might include things like has the ability to lead themselves, has strong professional values, can build effective relationships, is good at collaboration, knows how to shape the future, is good at organisational leadership, can manage the context. There are a range of categories, and they're all important attributes for a leader to be able to develop in order to deliver all elements of their role. And under each of these high-level capability categories, they're further specified into detailed subcomponent elements. And the subcomponent elements is where we identify what those learning objectives are for professional development offerings that we might choose to either adopt because they already exist, or to create either in partnership or alone in order to be able to fill that need or capability gap. And so if I give you an example, I mentioned leading self before as a really important component part of being a leader. That might be broken down into things such as resilience and courage, self-awareness, the ability to have self-care and to manage your own personal well-being, your own ability to do professional goal setting and career direction and finding your purpose, and emotional intelligence. It's the component elements that then are translated into our professional development offerings. And once they're made available, then individuals working within the sector can look at and see, well, this is my gap in this particular area. So that's really the professional development opportunity that I need to focus on for this next year or for this next period of time. And really, as I mentioned before, we focus from board members right down to new and emerging leaders in their first role as a people manager within the healthcare sector. And so as we go through our professional development work, it's all about making sure we cater to the needs of those different levels rather than treating them generically. So how are we going to do this? Basically, it's a 6-step process, and we're currently hovering between step 2 and step 3. And step 3 is where I want you to get involved, which is why I'm talking to you today. So the first thing we did was analyse and learn from that leading practice that I mentioned before. We've taken a really deep dive comparative analysis of all of the most well-known, publicly available, well-respected leadership capability and competency frameworks that exist for the healthcare sector. We're now in the phase of stepping into sharing those learnings with the key stakeholders in the sector, and then the important bit, undertaking that comprehensive stakeholder engagement process to seek feedback. And that feedback can be things like, do these capabilities resonate with you? Which ones do you think are the highest priorities? What's needed and uniquely for the Victorian sector that's been completely missing in the analysis that we've undertaken to date? It's really important that we get that feedback as broadly as possible from across the sector in Victoria, because we know that metropolitan organisations have different needs and challenges than regional organisations, for example. Different size of providers and different natures of providers have different requirements in terms of the priority leadership skills they need to develop, and the span which someone sitting in a leadership position might need to do. Quite different if you're CEO in a small rural health service than if you're a CEO of one of our large metro health services. So we really need to get this understanding from as broad a framework as we possibly can. From that, we'll then develop the first iteration of our VHA leadership capability framework. We'll release that for further consultation and feedback, and we'll then finalise the first iteration. I always like to work on don't let perfection get in the way of the good. So we're going to make it as good as we possibly can and get to as many people as we possibly can within the next few months. But then we're going to release it, and we're going to release it on the understanding that we're going to have an annual update. So we're going to continue learning, but the sooner we release it, the sooner we can focus on those professional capability development gaps that are missing. The sooner we do that, the sooner we can start meeting those needs for people. So for this next step in the process, we are keen to get your feedback, and I'm going to talk to you in a few minutes about how you can contribute into this and where you can see information. But really, we need to know your open and honest theories about what's important to the Victorian sector. And so once we've done that, we will be in a place where we've defined those core capabilities for leaders. we will have identified, acknowledged the learning and development offerings that we have identified that best meet the needs of our members if they wish to uplift particularly specific skills or capabilities. And then the third and final part of it, which is a really important component, is support our members in navigating to the offerings that best meet the needs of an individual in their organisation at a given time. Because I don't know about you on the line, but if you Google healthcare leadership training, you'll just be attacked with a myriad of information. It's really hard to know which are the most appropriate offerings, which have value, which are credible, which are worth the money, because there's a vast range of pricing differentials. So one of the VHA's important roles is to be able to cut through that noise for the members so they have an idea of where to go when they know the need they need to. So that's the whirlwind tour I wanted to take you through. It's really key to this now is your input. So once again, if you have any interest in getting involved or giving your opinion, please subscribe to our VHA update. It's a fortnightly update. If you haven't already subscribed to it, it doesn't only talk about this work of the Leadership Capability Framework, it talks about all of the things that VHA have going on at a given point in time. So hopefully it's a really rich source of information and connection for you. And we're really keen to hear from you because we do our best work when we understand what your needs are. So I'm going to pause that at this point in time and do a bit of magical technology work. I'm going to stop sharing. I'm going to ask Emma and Jenny to come back on the line. Thank you. And we now have about 10 minutes available for questions and answers. So I'm going to click on the Q&A. All right. So the first question is for you, Emma and Jenny. If we had a great training package, how could we make it accessible through free TAFE? And can you assist with this?
Thank you very much for the question. I'll jump in and Jen can feel free to add on if she'd like to at the end. In terms of the free TAFE list, both the national government and state and territory governments have got their priority list of free TAFE. So it generally looks at where there's workforce shortages or where there's a particular need. So I guess it by and large does go to shortages. So it'd need to meet particular criteria to go onto the free TAFE list. So you'd be aware that that's been added to in Victoria over time. So I think when free TAFE was first announced, we had a much smaller list and we've seen different qualifications added onto that. So it would need to meet particular criteria in effect to hit the free TAFE list, and possibly a conversation with the Department of Education and or Minister Tierney's office in terms of whether it meets those criteria. Jen, I'm not sure if you wanted to add anything in.
Yeah, look, the only other thing I would add is, as Emma said, part of our remit is to highlight good practice or where innovation might be occurring. So if there's a course that's not on the national database of courses, then it's something that we're interested in looking at and seeing if that's something that's scalable or something that can be rolled out into other jurisdictions. So it would also be something we'd be interested in seeing.
One of the things, Emma and Jenny, that I have really not struggled to get my head around, but adds a layer of complexity for me as we do the work in VHA around leadership capability, is just the level of complexity and the nature of different skill sets and the different training opportunities that are available for people. And some of them are within the remit of TAFE and VET and the work that Human Ability does. Some of them, particularly in healthcare, are stepping more into the higher education sector. So there's obviously a boundary at which your work ends and the work of others will pick up. Just wondering if you give any insights for the people on the call on where that boundary sits. And if it's outside of the boundary of human ability, is there anywhere you can point people towards for information, advice, where to provide their feedback and suggestions?
Absolutely. And I'll start, and again, I'll then throw to Jen. So there's a few different things. One is when we look at the background of courses, there's an element to, if you like, the history. And I would say the history is not synthesized evenly across all courses. So when looking at health, for example, there are a number of courses that are competency based. So for example, if you need to be an registered nurse, there's this particular competencies you need to be able to demonstrate. And so courses are very tightly aligned to that. That's not the case in all courses, and arguably it doesn't need to be either. So there's actually a national skills review or qualifications reform piece of work that has literally just been launched a couple of weeks ago, which you can find online, and it's suggesting that there might be opportunities for a new way to approach what's considered within courses, and they've broken it into 3 different priority areas, one being competency-based courses, which again I think would go to areas such as nursing, but also to some of the trades. So for example, looking at electricians, etc., there are key things that you need to be able to do in order to be able to do your course, but recognizing that in other areas there might be a different way to approach how training is comprised. So that might go to saying, well, there's some units of competency, but then there's some other skills that potentially might be able to be applied across a range of courses. So that's generating a whole new discussion, and we are being asked as Jobs and Skills Councils to think about what might we be able to look at in terms of demonstration projects or in other ways. One of our fellow Jobs and Skills Councils that works with, particularly in terms of technology, is also looking at what might be some of the options with the technology. So most courses will have a base, or not most, but certainly a number of ours and others have a base sort of component that's about competency in terms of looking at technology, but they're all different. Not all, but a lot of them are different, or they could do with an update. So we're thinking about what might actually be similar, and potentially, even if someone didn't finish a course, could that in and of itself be recognised as a micro-credential, for example? So there are things that it's a very live discussion at the moment, saying a number of the courses, if you like, have been static over time, and what might the opportunities be. So that work is underway. The other thing I would flag is people, as you know, Helen and other people on the call be aware, there's a lot of interest in micro-credentials at the moment, and different schools have thought about how they might be navigated, because we want to make sure, particularly if people are paying for courses and they're paying in their time in any case, we want to make sure that micro-credentials are of high quality. And there's a lot of discussion around, if we were to undertake micro-credentials, for example, rather than thinking of them just as an add-on, and there is absolute value in that. So for example, thinking about the leadership capability work you were putting forward earlier, could components of that potentially be broken into a micro-credential, or would it be actually something bigger? But could potentially different units in and of themselves be contemplated as a well-recognised and well-regarded micro-credential that would genuinely add value to someone's career, their CV, opportunities, and to employers as well, as seeing, someone's completed this and I can see the real value in it. There's lots of work underway at the moment. It's a really good question because it's a very live topic right now. So we all met in Canberra a couple of weeks ago, week and a half ago, to start to kind of tease through what are some of the opportunities we've got that we haven't really had before. And Jen, again, I'm not sure whether you wanted to add something further into that as well.
Yeah, I was thinking about how I think Helen and I had discussions over dinner at the Alice Springs event around this project and that notion of the pick and mix element of the individual. So particularly within healthcare, it's sort of choose your own adventure in terms of your career path. So something that we're working on, and we have a project around mapping career pathways, because you don't know necessarily when you come into an entry-level position within our sectors where that might lead to. So the first step for us is to do a mapping piece, and we're focusing first of all in aged care and disability support. And I know some people on the line might be in public aged care. So I would encourage you, once that project is up and running, we'll be out consulting to get really strong case studies and a clear sort of understanding of what are the career pathways, which links into that leadership development piece, because there are so many different ways you can upskill yourself. I know, you know, the innovation science as an example of a way that a lot of nursing professionals might upskill in order to get into more leadership positions. So there's a lot of outside of vet and higher ed options available. But for us, from our perspective, it's looking at what are some of those typical career paths that people don't necessarily know when they're coming in, and how can we promote those career paths, but also potentially support in the way that Emma's talking about, for a more of a kind of a sector-wide approach to leadership development, or whatever that might look like.
Great, thank you. Now we do have we've had a bit of a flood of questions, so I'll just reassure everyone we'll do our best to provide fulsome answers over the next 5 minutes or so. I suspect we won't get to everything, but we do undertake to respond to all of the questions offline afterwards. So we'll be sending out a copy of the recording of this webinar if you've missed bits of it, or you want to go back and rewatch some of it. And we'll also answer any of the questions we haven't managed to get to as part of that information we send out too. So if you've got a question and you still want to know the answer to it, put it in, even if you think we won't get time to talk about it, because you'll still get an answer offline. So moving along to the next question, and this is for you guys, Emma and Jenny. A lot of the skills and training in the disability sector happens in the unaccredited space. What are your thoughts on improving trust and transferability to acknowledge the existing skills in that workforce?
Yeah, I reckon that's a big question in terms of, and I think it's work that the Disability Royal Commission is wrestling with at the moment. And it's interesting in looking at similar work that's being undertaken in other jurisdictions as well. So, for example, thinking about the piece around registration of workers, and knowing also that within that, certainly the feedback I'm hearing from other jurisdictions is that where that is most successful, it comes down to looking at how we value the workforce in those sectors, rather than looking at it from a really tight safety point of view, which is obviously really important as well. But there is a piece in there that's about actually really recognising the value of the workforce that we have, and the value of lived experience as well within that. So I think it's a really good question, one that's under active consideration in terms of looking at recognition of the workforce and some of the work that has been, or the courses that have been undertaken at the moment, noting that without knowing exactly which ones you're talking about, we do know that there are great providers around and there are not so great providers around. So I don't want to make a blanket comment about the worth of every course that perhaps everyone has undertaken, but whatever steps there are going forward, it will be really important to really recognise the skills and attributes and existing qualifications in terms of what people have been able to offer to date.
Great, thank you. I'm going to answer a couple of quick ones about the leadership capability framework, and there's probably then time one more that I'll come back to you about, which is a question around placement poverty. But Michael has provided a comment that they've just launched their own leadership capability framework. Well done, Michael. You and I need to talk. One of the areas that Michael has found challenging is then getting the funding and investing staff to develop the capabilities we need in the leaders. Absolutely agree. The question is, any ideas on the time frame for the work that VHA is doing in translating the needs identified in the leadership capability framework into actual professional development offering? The answer, Michael, I think is going to be how long is a piece of string. Now, my aim is really working in the 3-year strategic plan. So my personal obligations is to take VHA as far as I can in this space before the 30th of June 2026. But it really comes down to how many priority areas are identified and how many of those existing training opportunities that are of high quality and value already exist in the market, because it's a lot quicker to navigate people to something that already exists than to create something from scratch. So our focus is very much on the next 3 years. I would absolutely expect to hit all of the top the super top priorities, but it really just depends on the span of things that get identified through our sector consultation. And then you might have heard my alarm go off in the background, so I'm going to ask for a very quick response to one last one around placement poverty. Emma and Jenny, are there any initiatives that you're aware of at the moment to address that placement poverty issue that you mentioned before?
We know that it's under active consideration. We know that government is fully aware of placement poverty and the issues that exist. In terms of any, well, how can I put this? We know that there's some consideration at a Victorian level in terms of nursing, in terms of looking at the, the payments that have been given to some nursing students to look to offset costs. But I just think this is one of the burning issues when we look at the very reality of people who are living in poverty, because they're trying to undertake courses and get qualified. I don't think we're going to be able to progress and have the completion rates, whether it be at TAFE or higher ed, that we need without addressing this issue. It's a significant issue. As I said, there was a fantastic op-ed in this morning that highlighted people are genuinely living in poverty, or they're losing their ongoing jobs as a consequence of this. And we know that that's happening across from vet qualifications and higher ed qualifications as well. So certainly something that's under consideration by government. It'll be interesting to see where it lands.
Awesome.
And we hear it everywhere we go. Can I just really reframe that quite correctly? Everywhere we go, people quite correctly name it up. And for any of us with kids who might be in the uni sector, my daughter's undertaking a double in paramedicine and nursing, and the placement piece is huge. And we know that kids are sleeping in their cars. There's a whole host of other issues that are attached to that as well. So it's a burning issue.
Thank you so much for bringing that to the forefront and for making sure it reaches the attention of the people who are best placed to be able to assist us as a sector to do something about it. I am going to, unfortunately, due to timing constraints, need to draw this conversation to a close now. But thank you, Emma and Jenny, for sharing your insights with us today, and for everyone joining us online and engaging with us during the Q&A. We really appreciate your attendance and your questions, and we hope you found the session valuable. You'll notice that we've just dropped the survey link for today's session into the chat, and we ask you to please take a few moments to give us your feedback. If you thought it was great, tell us. If you thought it wasn't so great, please tell us that too. We want to continue to provide sessions that best meet your needs. Best way to do that is to understand what your needs are and how well we're doing at fulfilling them at the moment. As I mentioned before, any questions we receive throughout the session that we haven't been able to answer just yet will be followed up during our post-session communications, and we'll also share a copy of that recording and the slides that guided our presentation and discussions today, and you'll find our contact information there if you want to reach out to either Human Ability or us at the VHA to discuss further. So finally, to everyone online, a big thank you again to all of our speakers and to everyone online. We'll move to a close there. If you have any questions about the session, please don't hesitate to get in touch, and have a fabulous afternoon. It was lovely to see you.